Hi and welcome. I'm trying to learn medicine. Today, iron deficiency anemia. And after we've done that, we're going to do martial arts basic training. And if you participate in the martial arts basic training, then it's very honest. And we're talking about internal anatomy, the blood system, and disease. And this is no medical advice. I'm going to say that this time very clearly. This is no medical advice. We're just reading about it. Now, anemia, it was a couple of times mentioned, and we thought we had it, but we didn't know what it was. Now we see that this anemia part is sectioned into iron deficiency anemia, perineucleus anemia, and sickle cell anemia, and megaloblastic phosphate deficiency anemia. We haven't done anemia ever. Okay, let's read the introduction of anemia. A reduction in the quantity of oxygen carrying hemoglobin in the blood. So the hemoglobin in the blood is transporting the air, the thing to breathe, the oxygen, and now there are not so many ones often there. So basically there are not so many trucks. So there's not so much coming to the destination place. Anemia is the most common of all the blood diseases and occurs in various forms. Iron deficiency, perineucleus, sickle disease, and megaloblastic. Okay, the different types of it. And again, this book is from the 80s, maybe that's the fun for it. It's the most common one, and there are different types of it. Symptoms are tiredness, shortness of breath, dizziness, disturbed vision, headache and insomnia, palpitation, pallor of skin, loss of appetite and indigestion, swelling of the ankles in severe cases, chest pain in older patients. Each form of anemia may have one or two additional symptoms which are specific to it. These are listed below under the relevant form. Okay, we're having here tiredness, so when people feel tired, shortness of breath, they can't breathe, they don't have that much air to breathe heavily to run it down. Dizziness, I still don't really know what dizziness means. Disturbed vision, so they can't see completely good. Headache and insomnia, so they have pain with the head and they can't sleep good. Palpitation, I still don't know what palpitation is. Pallor of skin, I don't know what that is. Loss of appetite, so they don't like to eat that much. And they have problems with digesting the food. Swelling of the ankles in the case, so the ankles get bigger, and also chest pain in older patients, and they have pain in the chest as well. Okay, iron deficiency anemia, the most common form of anemia. It is caused by a lack of iron in the blood necessary for the production of hemoglobin. So the hemoglobin is a reduction in the quantity of oxygen carrying hemoglobin. So the hemoglobin is transporting it. And iron is necessary to produce the hemoglobin. It's like steel is missing. Iron is missing to make the steel. So steel is missing and the body cannot build trucks to deliver the oxygen. So iron is necessary to build the things which are carrying the oxygen. The condition is aggravated by pregnancy, heavy periods, or any blood loss. Premature babies are very liable. Okay, it gets worse when people are pregnant, when people have the periods, and also if they have blood loss at all, and if babies are born too early. Then I don't know what liable means, but then it's also a problem. Symptoms: sore tongue and inflammation on the side of the mouth. So the other things with the tiredness, shortness of breath, dizziness, and so on, blurred vision, disturbed vision. I don't even know what the other thing is. So furthermore, symptoms by iron deficiency are sore tongue and inflammation of the side of the mouth. I think that's interesting. And this is an interesting symptom. Why is it sore tongue? It would be interesting to know. And inflammation on the side of the mouth. Dry and brittle nails. Do you have dry and brittle nails if I have iron deficiency? Maybe. This is not medical advice, maybe. Duration. The condition persists until treated. So until it is treated consistent. Causes: loss of blood due to heavy periods or tooth extraction, for example. They will not just say that it cannot be the only reason. Let's see that. So a lot of blood loss, for example, through a heavy period, and also if tooth are extracted, and there's also blood loss, I guess. Not just tooth extraction itself. Whatever. A diet deficiency in iron. So it can also be caused because people don't eat enough iron. And again, this is no medical advice. Diseases of the bowel in which absorption of iron is prevented. So if the bowel is for some type of reason not getting the iron out of the food. Diseases of many chronic infections which interfere with blood formation. many chronic infections which interfere with blood formation. What was blood formation? And why is not that the cause of iron deficiency anemia? Whatever, there can be also a problem with production of blood. But what has it to do now with iron deficiency? Diseases such as gastric ulcer, cancers, and piles, in which there is hidden blood loss. Okay, people can have an ulcer, I think in regards to a tract somewhere. People can have cancer or piles, and that condition causes somewhere blood loss. And now the iron deficiency, of course. Now, I said it in the histology part. How much blood loss or how much iron could the body need to produce hemoglobin? How can it be that a body with 50, 60, 70, 80 kilograms has an iron deficiency just because of a little blood loss? This is on the total amount of the human body. How can that lead to a deficiency? Are some things in the human body so sparely, I think is the correct word, sparely there, but just a little imbalance for the whole thing out of the order? And maybe the first question would be, how fast does an iron deficiency in eating lead to such things? Because then it could be trackable. How long is the, what is it called? How long could the body go basically without it? How much capacity, how much storage does the human body has for things like iron? Hours, days, weeks, because how's it all built? Several diseases of the blood in which the red blood cells are destroyed. So people can have also diseases in which the red blood cells are destroyed. And these red cells, blood cells, obviously hemoglobin things. Whatever, this is a problem. Complications, none. They say none. But I think that means serious complications. Treatment in the home, none. But I think people can eat if it is part of the eating. When to consult the doctor? If the symptoms described develop, so if people have these symptoms, to consult the doctor. What the doctor might do? Examine the patient, so examining, take a blood sample for testing. We're taking a blood sample. If a diagnosis is confirmed, prescribe a course of iron tablets or occasionally iron injections. So iron tablets are there. How much iron is in them? And how much iron does the human body need? And why is such a little thing causing? And I have no first how little thing. So how much the amount of iron is, and how fast it comes not to what consequences in the human body. Exactly, not more or not words like more or less or more likely, sondern exactly with numbers, with math. And also treat any underlying cause. Well, if I find it and if we're able to treat it, when we're treating. Prevention. Ensure that the diet contains sufficient quantities of iron. So people should make sure that the diet contains sufficient quantities of iron. And this is no medical advice. Report any excessive loss of blood to the doctor so that it can be treated before anemia develops. I don't get it. I get what is written. I'm wondering about anemia. I said the amount of iron needed in the human body. How fast does what deficiency of iron leads to what? How fast blood cells produce insulin? Report any excessive blood. Okay. During pregnancy and heavy periods, women should seek medical advice and take iron tablets conscientiously. With conscience, is that it? Conscientiously. Whatever. There are some tablets and people who are pregnant or having heavy periods, so to consider them with a doctor is not medical advice. Outlook. Excellent. I think excellent. The condition should be cured within 6 months of treatment. 6 months of treatment. So how fast does not 6? Now we're talking simply about 6 months. So it's not a thing which happens after 2 days. How long is the storage of blood? Now it would make a bit sense if just the amount of blood loss of 100 milliliter, which is already quite a lot, but 100 milliliter on the whole body with 70, 80, 100 kilogram, whatever, or 60 or 50, is not much. And there's still a lot of blood away if people lose 100 milliliter. If that causes us already, it makes sense if it would need for the human body 6 months to restore. So how much storage has the human body of things like iron in case that they have blood loss or something? And why does it take 6 months to refill it? The condition should be cured within 6 months of treatment. If the underlying cause is diagnosed and treated, anemia is much less likely to recur. Okay, people can get it again if they have some underlying cause or whatever. And that wasn't treated. I'm having a lot of questions still to iron and the blood and all that thing. Not so much to anemia, actually. So that means the text was good. I understand what iron deficiency and blood is, but they have way more questions to the metabolism or whatever of our body. We will continue then something else. Now, that was the iron deficiency part of medicine. If you were here for medicine, and this was no medical advice, then you can go directly to the next part of medicine, where we will probably not answer these questions I have to iron and all that. We will do it some days, wherever I find the answers to that. If you were here for medicine, you can go directly to the next part of medicine. If you're here for martial arts basic training, we're going to do the martial arts basic training. If you stay and participate in the martial arts basic training, then it's better down risk. And we're starting with bringing one leg up. And you're putting the foot down. And the other leg up and point the foot down. And now the train stop, go to the side. The toes are pointing in front of the stretching the inner side of the leg. And over the other side. And now the mentis go from side to side. And now what are we doing now? I'm thinking about the iron thing. We're doing the next thing. We're doing lunges. We're going in front and we're going back. No, the other leg in front, and knee down and back. And leg in front and back. And last time. And now the shoulders down claw, leg up and back. Back 3 steps, leg up and back. 1, 2, 3, and back. 1, 2, 3, up and back. And now a frog. Up, out, and in. Up and back. Now stretch kicks. Hand out, kick against it. 2, 3 steps in the middle. Hand out, kick against it. Hand out and kick against it. And again. 1, 2 more. So, and now Kreskin kicks. So, leg out and back, up and in, up and back, up and in, up and back, up and in. Okay. And the next exercise, I think actually, lunge kick. So I'm going to kick now close to the camera. In front with a knee down lunge, and then kick in front, and come back. And with the other leg, right leg in front, knee down, and kick, and back. And left leg in front, lunge down with a knee and kick. And right leg in front, knee down and kick. And again, left leg in front, knee down and kick. And now squat kicks down into squat and kick to the side. Down and kick. Down and you can do wider squats. Down and kick. And now with side kicks, with swinging, bringing it up. 1, 2, 3 steps, swinging and up. 1, 2, 3. Let's swing. 1. Swing. 1. Swing. And now 12 push-ups. Hands underneath the shoulders. Strong neck. Tuck the pelvis in. And go down with the elbows close to the rib cage. And this was the first one. And the second one. The third one. And the fourth one. And then number 5. And 6. 7. And number 8. Another number 9. And 10. And let's do 11 and 12, the last one. And it's touching your heel onto the ground and pull the toes in. Put to the left and pull the toes in. Put to the right and pull the toes in. Into the middle. Move the leg from left to right. Upper heel onto the ground, pull the toes in. Put to the right, pull the toes in. Left, pull the toes in. of the leg from left to right. And legs wide apart, breathing out. And breathe out. Breathing close to the legs. And breathing out. And that was emotional basic training. I thank you very much, and until next time.